If you're living with hand and wrist pain or experiencing weakness in your hand or wrist, and you're looking for simple and effective ways to improve your symptoms with physiotherapy, this video is for you. I'm Pam, and I'm a specialist hand and wrist physiotherapist at Ross Hall Hospital. I'll be sharing some effective hand and wrist strengthening exercises you can do at home and at what point to seek specialist support. Why would I need to strengthen my hands and wrists? Hand and wrist weakness is quite a common complaint, and while it might seem counterintuitive to exercise if you're having hand problems, strengthening the area using physiotherapy has a whole host of benefits. Strengthening your hands and wrists can reduce muscle and joint pain and stiffness, improve your performance in sports as well as everyday activities, prevent injuries, and generally improve your quality of life. More often than not, if you catch hand and wrist problems early and take time to practice exercises to ease and manage your symptoms, you can delay or even prevent the need for further treatment. The exercises I'm going to show you will take a good few weeks to feel the benefits, so stick with them. If you keep them up regularly, you'll soon start to see an improvement. All of these exercises can be done at a table at home, for instance your kitchen table. The first exercise is wrist flexion. Wrist arthritis or after a wrist injury, your wrist flexion can be significantly reduced. These exercises help restore your range of movement and stretch the muscles in your forearm. You need to find yourself a table, sit at the edge of the table and hold your hand on the table like this. Let your wrist bend and use your other hand to gently press till you feel a stretch on your forearm. Hold this for up to 10 seconds. Exercise number 2 is wrist extension. This is really important for things like getting off and on the floor, pushing yourself up from a chair, and quite often after injury, we can lose wrist extension. If you take your hand to the edge of the table, bring your fingers up towards you, use the other hand to gently press to extend the wrist. Hold this for up to 10 seconds. Exercise 3 is wrist deviations. This can help restore movements after injury, for instance playing tennis or golf. Take your hand to the edge of the table, make a fist and push towards the floor to bend at the wrist. Hold this for 10 seconds and pull your wrist towards you so you bend underneath. Exercise 4 is thumb oppositions. Conditions such as thumb arthritis can lead to pain and stiffness when moving your thumb. This exercise will help you restore range of movement. We take our thumb and reach toward each individual finger one by one. You can repeat this up to 10 times. Exercise 5 is stress ball squeeze. After pain or injury in your hand, you can often lose strength in your grip. You can use a stress ball or a specialist hand therapy sponge, which you can buy online or from us at Circle Health Group. If you take the sponge in your hand and squeeze between your fingers and thumb, this will help mobilise the joints in your fingers and work the muscles in your forearm. Repeat this up to 10 times. How do I know if I need to see a physiotherapist? If your pain is very severe, if you're getting worse, if it's affecting your sleep, if you're having to use increasing amounts of painkillers that aren't working, if your grip is worsening and you find yourself unable to open jars, write or type, or even hold on to objects easily, basically if things are getting worse, I would advise you to see someone. If hand and wrist problems are left untreated, they can get worse. The sooner you get treatment, the better. If you've tried these basic exercises, but you're still experiencing hand and wrist problems, it's useful to know that you don't need a GP referral in order to see a physio at your local Circle hospital. Simply go to circlehealthgroup.co.uk and use our easy online booking system. Our team can help you work out if you need further treatment and can arrange for any scans or refer you on to one of our specialist consultants if you need one. If you have any questions or comments, we'd love to hear from you. So please comment below and we'll get back to you as soon as we can. Thanks for watching.